Hi, I'm Brianna Bryant. Over the summer, I was the Arthur Vining Davis Fellow in Clinical Psychology. My internship was at the University of Iowa Hospitals and Clinics in the Fedoretz lab. I'm originally from University Place, Washington, and I'm a psych major. So, I was in Fedoretz lab. This is Dr. Jess Fedoretz. He is a part of the psychiatry department. He is also my site mentor. These are some of the people that were in the lab. There are actually a lot of people, but these people I spent the most time with. So there's Dr. Fedoretz, Janie Myers, Amy Strood, and Lucia Bossi. So I did a lot during my internship, but these were the studies that I spent the most time on. So we have ACT on Anxiety, Revive, and T1 Rome. So ACT on Anxiety is actually acceptance and commitment therapy on anxiety. That's a type of cognitive behavioral therapy. So what I would do is I would set out surveys that they had to do and then get the equipment ready for when the doctor would come in and take epithelial cells and blood draws. And then I would take them down to a couple other places, but this is one of the main things that was added while I was here, while I was at the University of Iowa. So this is an optical coherence tomography, and so this is one of two in the United States. It's about $300,000, and I actually got to use it, which was amazing. So I got to practice on one of Dr. Fedoretz's medical students, and then he practiced on me. This is actually my retina scan. It's cool. So and then I did the Revive study. So that is a study that while I was there, they were no longer taking participants anymore, so it was purely in the analytical phase. So what I would do is basically data mining. So I organized all of the data, created Excel sheets. If some of the information that I was looking for wasn't in their participant files, I would have to go into their medical records and try and see if I could find it there. T1 row that is for, it's a study about bipolar disorder. So what they would do is they would take bipolar patients in different states, manic or euphoric, and image their brain. And so while I was there, they actually didn't have any participants, so I was just working with the data. This study has been going on for about 5 to 6 years, so I started from the beginning, and I went through and looked and made sure that everything was entered into their online database, REDCap, correctly. And if it wasn't, I changed it and noted that. So, what I learned. I had to do a lot of things. So, basically, this is the other room that I took the ACT participants into as well. But I learned how to conduct myself in a graduate level lab, especially because I plan on going to grad school. This was a great little scope into what I will be doing. And using state-of-the-art technology. I'll never probably touch that machine again, but I can say I did it. And actually, Dr. Fedoretz let me, he's also like an MD as Anna, and he has a PhD too, but he's an MD, so he has patients. And I got to observe his sessions, and it was amazing because after, if he would leave the room, they'd be like, he's the best doctor ever, you're so lucky to be with him. And I actually felt like I was lucky to be there with him. And then I got a nonviolent crisis intervention training. So for T1 row, we thought that we might have participants. And for me to be able to walk them down to the MRI machine, I needed training for that. So I got that training, and what they taught me was how to de-escalate a situation verbally and physically. So if it wasn't working verbally, I learned moves, how to do it physically. And actually, even though I didn't get to use it, it's something that I could use in my everyday life, honestly. And I've had to use the verbal, I've used the verbal, not the physical, a couple times. So, and these two are just examples of data that I went through for T1 row. And this is for Revive. So these are all the participants' information. And then in the back, there was drawers. And then on the side, there was more. So I had a lot of work for Revive, but it was great. So work culture. The office was great. So we had to work with, bipolar patients and people with anxiety, which can be heavy. But the office was very lighthearted. Just made sure to keep it fun. So if anyone accomplished anything, let's have a party. Let's get food. So that's what those were. And then one day he was like, let's go bowling. And originally I thought, I was like, oh, this is a nice gesture. But really it was just his way of just being able to show off. Because look, he has like perfect bowling form and he beat us all. He brought his daughter as well. She beat us too. So it was like, it was a Fedorowicz takeover. So it was great. And I learned that when I apply to labs, this is the type of lab I want to work in. I want to work somewhere where the lab director actually cares about my professional growth and is actually excited about it. So internship impact. So I am on a eating disorder research team here. I talked to Jess about that, he knows that. So he set me up with Dr. Wayne Bowser. So he is the head of the eating disorder wing at the hospital and clinics. And so when we talked to him, he was like, well, whenever you're not extremely busy, you can come up and sit in on group therapy sessions, which was great. So I got to see that. And then I got to talk to him a little bit about being a clinical psychologist. And he actually let me read one of the manuscripts that he's writing right now, which is amazing. And then following in the footsteps of my mentor, one day I was at the water cooler. And I started talking to this man, which is Dr. David Mosier, and I set up a meeting with him to talk to him the next day. And after I set up the meeting, I had to call my mom and be like, oh my God, I just did the most adult thing ever. I met someone at the water cooler. Like, I was amazed. And so I talked to him, and we learned, he taught me about PsyD programs, PhD programs, masters, assistantships. It was very informative, great conversation. And he actually told me that when I'm ready to apply for grad schools, if I want to contact him, he'll give me a advice and like an opinion. And I was like, oh, that's great, because I am very much so frazzled about that right now. So it's nice to have an outside look. I'd like to give a special thanks to the Arthur Vining Davis Foundation for funding this for me. My site supervisor and mentor, Dr. Desper Desert, he's over there, he's great. And Sue Atsley for sponsoring me and being my academic supervisor. She actually connected me with Dr. Fedorowicz, so I appreciate her for knowing me well enough to know that that would be a great fit. And she's also the head of the Rise Up program, which helped me fund a little bit, and that is a program for first generation students. And of course, Cornell Fellows, thank you.